This lecture is going to be about systems thinking, which is sometimes called holistic thinking. It can be an abstract topic, but you can help me make it real for you by thinking about the systems that you're part of, your extended family system, the schools that you've gone to, and maybe the larger educational system that they were part of, your workplace, your community, your neighborhood, even your country. We're all part of systems, and even our bodies are made up of systems, all the parts working together, hopefully, to produce good health. Stop and think now about the systems outside of you. Most of us are so busy day to day, we're out there hoeing the fields with our heads down, that we forget to stop, put down the hoe, and climb up on the hill to look around a little bit. This topic is really about looking around from a height and realizing the complexity and the interdependency of the systems in which we live and work. This topic is about big picture thinking, which is an essential skill for all managers and leaders. Because I lead a large organization, I spend a lot of my day looking at issues from a height, from a systems thinking viewpoint. Like you, I work in a public health setting. My work setting is in a very large public university that's governed by the state I also live in. My program receives funding from the U.S. government, and those funds flow through several large federal agencies that monitor us. All of these are big systems in and of themselves. In order to work in each country, we need to be invited by ministries of health to work there. And each country has different laws, different languages, and different kinds of traditions. Each country is a collection of systems, and each Ministry of Health itself is a system. I've just named some of the systems that I have to be able to see, to understand, and to navigate each day as a manager and leader. This I need to do just to do my job on a day-to-day basis. My job is to apply judgment in decision-making, and in order to do that best, I really have to be able to see all of these factors in our day-to-day decisions. What systems are you part of? We're all raised to be part of a family system, of course. You're part of this course. While we each learn individually, we also gather as a group and we learn in a system. We're all part of complex organizations where we work, too. We're also part of community systems and the massive system that is our country or our nation. This topic, in other words, is relevant to everybody, especially to those of us working in complex health systems. Julio Frank, who was the former Minister of Health in Mexico and is currently the Dean of the Harvard School of Public Health, Julio Frank said that public health is in a kind of revolution right now, that we're currently at the threshold of a new era because of 4 particular revolutions that are going on. In this session, we're going to focus on one of those revolutions, the systems thinking revolution. These 4, according to Frank, include advances in the life sciences, causing a revolution for us in public health, a revolution in information and communication technology, as well as advances in ideas about social justice and equity, all of these fueling public health, and finally the one that we focus on here today, systems thinking in order to comprehend and transform complexity, to use systems thinking to solve problems, in other words. The goal of public health leaders and managers and health workers everywhere is pretty simple. It's to improve the health of individuals and populations. It sounds simple, and yet we all know it is anything but simple. The goal of improving health outcomes is often only achievable through the efforts of many people from many different disciplines. It's by its very nature highly complex. Such complexity as we deal with day to day is the landscape for public health. It's a given. Acknowledging this, the question for us then is, how can we best work to strengthen healthcare systems and improve health outcomes in these highly complex environments? In this session, we'll focus on systems thinking as a practice for working in partnership with others, for working in complex environments, and for creating effective interventions that achieve our goals. As Dr. Frank suggested, systems thinking can help us to comprehend the complexity of the various systems we work in, or the systems that impact upon us. It can help us think of those complex systems not as a problem, where we end up blaming administrators or funding agencies or whoever, but rather as a source of opportunity or as ways by which we can improve how things are done. We can do this latter by understanding those systems and how they interact. They do present opportunities for us. Systems thinking essentially is big picture thinking. In fact, one of the insights that I hope you'll take from this session is that complexity is not automatically a negative thing, and it isn't the same thing as chaos either. Systems are organized even when they're complex. This is our reality. With the right approach, complexity can be seen as fertile ground where we find multiple options for how to approach a problem. This is at the heart of systems thinking, that we're able to recognize complexity, embrace it, and work together with others across different systems to find solutions and to change the outcomes. Approaching complexity as a positive thing also supports our goal of building diverse and cross-functional teams, and it works well with building collaborative partnerships across agencies. Let's back up now and talk about what is systems thinking. Peter Senge, the author of The Fifth Discipline, is one of the foremost theorists in management and leadership theory from a systems perspective. He defines it this way: systems thinking encompasses a large and fairly amorphous body of methods, tools, and principles, all oriented to looking at the interrelatedness of forces and seeing them as part of a common process. Senge is part of the revolution that Julio Frank talked about, a revolution that encourages us to approach our work by acknowledging complexity rather than searching for simple, singular, cause and effect answers. We'll talk more about this in a minute, but here's a second definition that I actually like a lot. This definition reads, systems thinking is a thought and review process that fosters looking at the whole rather than the parts in order to understand an organization or a situation. In other words, for instance, if I heard that money had gone missing from one of our units, I wouldn't think right off about the individual who took it. Instead, I'd think about our financial systems and whether our financial controls are adequate. This is systems thinking. Simplistic thinking, or linear thinking, which is also sometimes called event-oriented thinking, would have me going from A, where money's missing, to B, to the question of who took it, to C, how can I fire him or her right away? Contrast that with holistic thinking or systems thinking, where I'm going from A, money is missing, to D, F, and G. I'm asking, what are the forces that allow this to happen? How are our controls? Are they adequate? Do we have a culture in that unit of turning a blind eye? These are questions from a systems thinking or holistic thinking point of view. I don't go right away to who took it and how soon we can get rid of that person. That's simplistic thinking. The habit of systems thinking will make you a better problem solver, and it will improve the systems that you're working in the long run. A working definition for those of us in public health sees systems thinking as an approach to problem solving that views problems in the context of a larger system. It sees systems thinking as a set of habits and practices that are based on the belief that the parts of a system are interrelated and not isolated. And it sees systems thinking as a shift from a simple, linear, reductionist way of approaching a problem to one that acknowledges complexity and multiple influences. I've been working recently with a university to graduate more doctors in a country that has a very severe shortage of healthcare workers. I've been working with the university to help them strengthen their curriculum, to recruit large numbers of students, and to hire instructors. But progress recently was almost halted by the fact that another big system, the Ministry of Health system, happens to operate all the health clinics and public hospitals in this country. Unfortunately, the ministry doesn't feel that their personnel have either the time or the training to incorporate large numbers of medical students and residents for practical training at these sites. This is a situation where you see two big systems colliding. Clearly, they should be interrelated and interdependent, but somehow they've gotten off track and are operating in a parallel way. Systems thinking during strategic planning would have identified this as a critical path issue that we could have anticipated and addressed in advance rather than playing catch-up now. This is an example of our working definition of systems thinking. Also backing up a little bit, what do we consider a system? Senge writes, "A system is perceived whole whose elements hang together because they continually affect each other over time and operate toward a common purpose." This is a system. In the last example I just gave, the university and the Ministry of Health have the same purpose, they have the same common goal, but they are not perceived as a whole, and they're not working holistically during planning. I work in a huge system. It's whole, even though it consists of colleges and schools and departments, all made up of centers and programs. All of these have been hanging together, all these parts have been hanging together since 1861, and they've affected each other over time a lot. The university fits the definition we're using of a system. At University of Washington, we all operate toward a common purpose, that is education, research, and service. This is a strong system, even though it has many, many, many working parts. It's a complex system with over 5,000 faculty, 42,000 students, and now we have 3 campuses. The Seattle campus alone has 16 colleges and schools, and there are dozens of departments and hundreds of programs within those departments. We offer more than 1,000 courses each academic year. This is truly a complex system, and it exists within another system, within a state with taxpayers, who are the stakeholders for the university, and it receives more federal funding than any other public university in the United States. Yet another system that interacts with the university. It's a system within a system within a system. Let's review some of the characteristics of these types of systems within which we all work. Systems are self-organizing. You've probably noticed that organizations tend to reorganize frequently. We realized recently in my own department at University of Washington that too many of our teaching examples and our case studies are HIV related. This is because there's been so much money for prevention and treatment of AIDS, supporting our faculty over the last 20 years. The curriculum, without anyone becoming aware of it at the big picture level, self-organized around a focus on HIV and AIDS. This is something that we're now working to address. Systems are often changing. In fact, I would say constantly changing. They're affected by the economy, by good or bad leadership. They're affected by feedback from stakeholders. Systems are governed by feedback, in fact. The voters provide feedback and essentially impact decisions that are made at the state or the national level, and our patients give us feedback that allow us to make changes within systems. Systems are nonlinear. As we've said already in this session, most problems have multiple causes, not single causes, especially in complex systems. Take an example. Imagine that a public health system decides to target tuberculosis because of unacceptably weak coverage. In this example, healthcare workers are going to be given cash awards every few months when they achieve targets for case identification and treatment of TB. This decision was in fact made, this is a real example, in order to achieve greater effectiveness in the health system. In fact, that did happen. It was achieved. However, so many healthcare workers from different parts of the system requested to move to the lucrative TB program that it left gaps in core services that no one realized were there for some time. The unintended effect of the intervention was to compromise the larger health system. Had there been an epidemic of measles, for instance, this imbalance or disturbance in the larger system could have had terrible effects. Systems are history dependent as well. All of us and organizations tend to shy away from painful experiences. Imagine the example above. If there had been institutional memory about that pay for performance situation that we just discussed, it maybe would never be tried again, even when it could have been implemented better in a more holistic way and might be an effective intervention. Systems are resistant to change. You know, people are people. Even though systems are constantly changing, people are constantly resisting change, and organizations are made up of people. And finally, a characteristic of all systems, especially health systems, is complexity. Let's look next at health systems as defined by the World Health Organization, or WHO, and also at the outcomes we're trying to achieve when we talk about strong systems. What you see in this slide are what WHO calls the building blocks for health systems strengthening. You see here the 6 building blocks on the left: leadership and governance, healthcare financing, the health workforce as a system or building block, medical products, technologies, laboratory services, information and research as a building block, and service delivery. All of these in the health system strengthening model of WHO are intended to impact on access to care, coverage, quality of care, and safety. No one system really can achieve access, coverage, quality, and safety alone. All 6 of these have to interact in order to achieve that, let alone achieving the outcomes of good health, a responsive health system, reduction in risk and risk protection, and efficiency. This model here, I think, is a good example of how all things have to work together, all the systems have to interact and are interdependent in order to achieve our outcomes. Together, as parts of an even larger whole, they can. Let's look at this example in this diagram. Systems thinking is going to allow you to map various interventions across multiple systems. That's what you see here in this picture. For instance, in this diagram, you see the axis on the left is complexity. The axis below is impact. The greater the complexity of your intervention and the greater the impact you're seeking, the more you need to think about systems. Look at some of the interventions. Things like guidelines for microscopy, changing a protocol for first-line malaria treatment, implementing a vitamin supplement campaign, adding a new healthcare worker cadre, or integrating bed nets into antenatal care, or even implementing a large scale-up of antiretroviral therapy. These interventions, as you can see in this diagram, grow increasingly complex in the systems that are required to carry them out and the numbers of people that will be impacted by them. Look at the health system's impact axis. You have things like worker salary, changing worker salaries or implementing a new vaccine, paying for performance, or implementing something as large as a national health insurance program, as we've seen here in the U.S. with Obamacare. These grow increasingly complex too in the systems that they require and the numbers of people impacted. So you see in this diagram, depending on your intervention, depending on the complexity of it, the scale of it, the number of people that need to be impacted by it, and the people who will adopt it, scale and scope, depending on the scale and scope and how large they are, systems thinking may be critical for implementing the programs. Let's take an example here, contrasting event-oriented approaches or simplistic approaches or linear approaches to systems thinking approaches. Taking, for example, here the problem of low TB uptake rates and poor adherence. In this diagram, which is looking at the problem from a linear or events-oriented way, you might choose to focus just on service delivery of TB, adherence and uptake, and on financing. It's inevitable in an example like this that you'll have a limited impact because all of the other systems are also involved in this problem. On the other hand, if you look at the same problem from a systems thinking approach, a much broader approach to the problem, all the health system strengthening building blocks are examined for their impact on the issue. For instance, good leadership improves accountability, which improves the quality of information available. Service delivery is related to access, including transport of patients. Transport is related to finance. Human resources either allows you adequate or inadequate coverage at your clinics, and information systems like electronic medical record systems help you deliver service better. And you can't treat patients and increase coverage if the drugs and vaccines aren't available. So you see in this systems thinking approach that it's more effective than simplistic linear thinking, and it factors in all of the forces at work on a healthcare issue. Some people think that there's an even more effective approach to problem solving called structural thinking. While we won't cover structural thinking in this course, if you're interested in this topic, I urge you to watch the optional video in this unit called The Importance of Structural Thinking. For the remainder of this lecture, though, I want to focus on an area where systems thinking is applied. It's an area that's very familiar to most of us. It's monitoring and evaluation. Here I'm using an iTech product called TEFT, the Training Evaluation Framework and Tools. I'm using it to think about evaluation in a complex systems sort of way. TEFT is essentially a systems thinking approach to evaluation where you're ultimately hoping to impact a health system, even through intervention as simple as training an individual. You can see illustrated here 4 systems or levels where we might anticipate an impact from training an individual person. That person, in fact, lives and works in several of these systems, if not all. At the individual level, training should lead to either knowledge, attitude, or behavior change, hopefully all three, and better performance at their organizational level, the clinic or the hospital or the lab where they're working. At that lab or clinic level, you would expect to see improvements in things like testing techniques or handling of samples or hands-on care as a result of the worker training. You want to see stronger on-the-job performance at that location or in that system. If you go up another level, at the health system level or the population level, you should be able to measure impacts on that system too. Fewer errors across your facilities or across your healthcare network, greater rates of adherence to treatment across your system of care. Things like this, all originating from the original training. You can see here that these three levels or systems are nested within one another in this TEF network, and all are contained within an environmental context or system that we'll look at next. Adding the environment here, we look at some of the things that will either help or hinder change to occur at all of the other levels. For example, at the individual level, a worker who's been trained can't be successful unless he or she has the right background knowledge to have been able to absorb new information. People all come from a prior educational system that was either adequate or not, and we know from educational research that you can't build new knowledge upon a missing foundation. Similarly, at the organizational level, a healthcare worker might not be able to use new skills because she doesn't have the medication she needs or the equipment needed to do the job, or maybe she's overburdened with a high patient load. And out at the population and health system level, we ask ourselves, are the systems in place to support integration of newly learned information? Do the clinics or labs or hospitals in the system have a common database for measuring change? Do supplies move regularly where they're needed in the system? Does the system have a good communication infrastructure, and are there enough workers even available? Ultimately, approaching training as a system and trying to evaluate its impact, you have to ask when you train somebody if that training will add value to the whole system, and if not, what are the barriers preventing it from doing so? This is looking at not just training as a system, but change, the change that's possible in the healthcare system as a whole. You can even look broadly at the environment or the environmental level or system, where politics, climate, and patient access issues can all impact on whether our training is able to achieve a desired effect. Here then is the complete framework for thinking about how and in what systems you might be able to evaluate the ultimate impact of healthcare worker training. Mostly we just measure at the individual level, but you can see from this discussion just how inadequate that really is. Humans operate within complex systems, and they are able to do their jobs or not as a result of the functioning of those systems. Let's finish this session by looking at the habits of a systems thinker. He or she seeks to understand the big picture. We've been talking about this throughout the lecture. He or she observes how elements within systems change over time, generating patterns and trends. A systems thinker changes perspectives to increase understanding. We all operate at different levels, and each of those levels causes us to look at an issue through a different lens. When you're at the top of an organization, you see things one way. When you're in the middle, you see it another way. And when you're essentially in the bottom part of an organization, you look at things very differently. So systems thinkers know this, and they're willing to look at things from these different lenses. Systems thinkers consider an issue fully, and they resist the urge to come to a quick conclusion. We know that event or cause and effect thinking is simple and easy, but not necessarily effective when you compare it to complex systems thinking and problem identification. Systems thinkers use understanding of systems and structures to identify possible leverage actions. For me, this is just being smart. I recently, just a couple of days ago, was asked by a fellow faculty person whether I thought she should start. She had been asked by the chair to take on a task, and she was asking me if I thought she should start with the faculty in terms of achieving this goal so that they would buy into the project that she's undertaken, and then take it up to the top, back to the chair and up to the deans. And my advice to her, and this is around leveraging, was to start at the top, because that's where the leverage often is with the gatekeepers. A lot of those people don't like to be surprised, even when they've asked you to do something. And so I told her my advice was to start at the top, make sure that your gatekeepers know what you're doing and approve of it, then go to the faculty for buy-in, and then come back up to the dean and the deans in the chair with your conclusions or your recommendations. This is using leveraging and understanding where to leverage in order to have the smoothest path towards your goal. Systems thinkers consider both short and long-term consequences of action. Systems thinkers consider both the short and the long-term consequences of their actions. There are nearly always consequences in one part of a system when you tinker with another part of it, and it's important to see that ahead of time. Some end up being long-term consequences and others quite short. And speaking of consequences, systems thinkers are in the habit of being aware of unintended consequences. I was told on a recent trip that in the country where I was working that doctors weren't paid enough and therefore every afternoon had to see private clients. The unintended consequence of this was that the public patients they saw in the morning were all crammed into a very limited number of hours and had long wait times and sometimes even had to return the next day. An unintended consequence of all of this, a secondary unintended consequence, was that many of the children were missing school because they had to come with their mothers to these appointments and couldn't go to school that day or the next day. So people need to think about the unintended consequences of all of the situations in our systems. Systems thinkers surface and test their assumptions. They ask themselves what lens they're looking at a system from and what other assumptions they might be making. And they identify the circular nature of complex relationships. I was thinking of an example for this, and all I could think of was, he takes from me, so I take from her, and she takes from him, and he takes more from me. These are the kinds of examples that we talked about in the emotional bank account, when you take withdrawal after withdrawal after withdrawal. And these things tend to be circular and to come back to us in some way. Let's end with some advice for practicing systems thinking. This comes from Peter Senge. Remember, there's no right answers. These systems are way too complex to have a single answer anyway. You can't divide the elephant in half, as Senge says. Systems thinking requires that you look at the whole, and this usually takes a whole team of people. Most of you have probably heard about the metaphor, the story of the blind people who are all touching a different part of the elephant. And they can't know, just from the part they're touching, what the whole elephant looks like. And this is what Senge means. You can't divide the elephant in half. You need other people. And you can't know from just touching your part of the elephant what an elephant is, what it looks like, how it functions, how big it is, how small it is, etc. Another piece of advice is to know that root causes will likely not be closely related in time and space. I experience this often as people just inheriting problems. A cause of a problem or a decision can have happened many, many years ago, and yet you might come into the situation inheriting the results of that original decision. And a lot of times, too, decisions are made for good reasons at the time, and then time and space changes everything, and you may inherit or find yourself with a decision that even you had made earlier that is no longer the right decision. Beware of the easiest, fastest solution to a problem. As tempting as it is, it's almost never the right solution. And resist shifting the burden to other systems. All of us end up blaming, the administrators or the university or the federal government or the ministry or whatever the other system is that we interact with for the problems or challenges that we're having. And treat all parts of the system with respect. This will sustain your long-term partnerships with others, and without those multidisciplinary and team-based partnerships, you can't solve problems. I had a conversation yesterday with our HR director, and he was telling me a kind of ironic story about a recent conversation he had with somebody who said that they didn't really need HR. It wasn't a necessary expense on their project. And the irony for him was that at that moment, his team was deeply involved was solving a major HR problem on that project, at the very moment he was being told that it really wasn't necessary. I think this, for me, speaks to the need to respect all parts of a system. We all operate better in partnership with the different pieces of the system that we're in. And showing respect for those pieces, whether you understand their full impact or not, is a good idea. So there's systems thinking in a nutshell. This is very much an introduction to the topic. It's a huge subject, and there are many perspectives on systems thinking, from engineering to genome studies to urban planning to education. Systems thinking is dealt with in all of those disciplines and others. We've applied it here to the health systems because we all work within that type of a system. Let's finish with this quote from another key author and thinker on systems, Barry Oshry. He said, "All organic systems, from the split-leaf philodendron to the common earthworm to General Motors, engage in similar systems processes. They individuate, integrate, differentiate, and homogenize. What distinguishes human systems from all other organic systems is that we think about these processes. We believe in them, we attach value to them, we politicize them, and we favor one over the other." Systems thinking is a realistic way to approach the management of organizations, and it's an essential tool in our personal management toolkits.